Endometriosis is a disease condition that occurs very commonly in women these days. 1 in 10 women suffer from endometriosis during their reproductive years. That is a current census. Many people have been requesting me over the last so many months for videos related to endometriosis. I have decided to start a video series on endometriosis, and this is the first video of the series. In this video, let's have a look at what exactly this endometriosis is and how it occurs. Hello everyone, welcome back to Mind Body Tonic, and this is Dr. Sita with you again. Endometriosis is a chronic and long-standing condition that causes so much pain and agony to the woman who is suffering from it. Many people have been requesting me for videos related to endometriosis, and in order to be able to tackle endometriosis effectively, we need to know many things about this condition. And this is the first of the series of videos related to endometriosis. In this video, let's have a look at what exactly endometriosis is and how it occurs. Before that, we need to know a little about the normal endometrium. Let's have a look at that first. In order to help you understand these things in a better way, see, I've got this made for you. This was made by one of my staff here in the hospital named Manju. She is very good in making such things, and she's making so many other things too, which will help me to help you understand things in a much easier way. She deserves a big round of applause and thanks from all of you. Okay, let's have a look at this. As you all can see, this is a uterus in the center, and on both sides you can see the fallopian tubes, and this is the ovaries on either sides. There are ligaments connecting these structures to each other. You need not know in detail about all these things. Basically, uterus has got 3 layers. This is the perimetrium, that is the outer lining of the uterus, you can see here. And this middle thing, that is the red colored part, that is the myometrium, that constitutes the muscular layer of the uterus. That is the middle layer of the uterus. And this inner layer, see, you can see this here, no? This is called the endometrium, and this lines the inner cavity of the uterus, which is called the endometrial cavity. It is this endometrium that undergoes cyclical changes every month under the influence of the hormones, estrogens and progesterones. Every month, right from menarche up to menopause, the endometrium prepares itself so that in case a fertilized embryo reaches a uterine cavity, it can nourish and sustain the baby. In case pregnancy doesn't occur, there is a sudden withdrawal of the hormones, especially progesterone hormone, due to which the endometrium that is attached to this cavity is shed. And along with some blood, it comes out through the cervix and through the vagina as menstrual blood. Now, normally the endometrium should be seen only within this endometrial cavity. Sometimes, due to various reasons, this endometrial tissue gets deposited in other areas like, see, the uterine muscle, the ovaries, the tubes, here, and in many other places all over the body. In all these places also, this endometrium has got the same properties like the endometrium here. So every month, under the influence of the hormones estrogen and progesterone, the endometrium elsewhere also starts to grow. And when pregnancy doesn't occur and the hormone withdrawal takes place, the endometrium there also gets shed. But unfortunately, unlike the endometrium here, which can pass out through this vaginal opening, the endometrium elsewhere has no provision to flow out of the body. So what happens? It gets stuck there. When this happens every month, after a while, what happens is, in the areas where these endometriotic spots are, there is inflammation surrounding that area, and lot of immune reaction also occurs. When such a thing occurs, due to endometrium being deposited in different areas, then a disease condition occurs, and that is called endometriosis. Hope this much is clear. If you did not understand, please do watch this portion of the video 2 or 3 times. Now let's have a look at the various reasons why this endometrial tissue gets deposited elsewhere in the body and grows. Or in other words, the reasons why endometriosis occurs. To be frank, no one knows the exact reason. There are many theories and postulates. Like polycystic ovarian syndrome or PCOS, endometriosis also has got a genetic background. In PCOS, it is a polygenic inheritance, whereas in endometriosis, only one gene appears to be involved. And that too, only in moderate to severe endometriosis. It is seen that minimal and mild endometriosis are not influenced by genetic predisposition. Teenage girls and women whose mothers and sisters have had endometriosis are more prone to develop this condition. However, due to the changing lifestyle, unhealthy dietary habits, lack of exercise, and poor lifestyle habits, many youngsters are developing endometriosis even if their mothers have not had it. The second reason that's being postulated is coelomic metaplasia, the conversion of one cell type or tissue type to another one is called metaplasia. According to this theory, it is thought that cells in various other parts of the body have got the potential to get converted into endometrial tissue. Some say that this predisposition occurs right when the female fetus is within a mother's womb, whereas others say that these changes happen in adulthood. Whatever it is, these endometriotic tissues behave in the same manner as the endometrial tissue in the endometrial cavity. The third theory that's being postulated is the Sampson's theory of retrograde menstruation. According to this theory, as shown in this figure, in addition to the flow of this endometrial tissue and blood outside through the vagina during menstruation, some endometrial tissues may travel up via the fallopian tubes outside into the pelvic cavity, get spilled there and gets deposited in various areas, which then start to grow and behave like the regular endometrium. However, this theory doesn't hold good many a times. 90% of women are shown to have retrograde menstruation at some time or other, that is, the backflow of some amount of blood into the uterine tubes. However, most of them do not go on to develop endometriosis. This might be the reason in some cases, that's all. The fourth theory that is being postulated is the distribution through lymphatic and blood circulation. This may explain the endometriotic deposits in various distant sites like lungs, brain, eyes, etc. The fifth theory that's being postulated is the immunological theory. It is not known whether immunological factors act as causative factors or whether they are the effect of endometriosis. Whatever it is, many patients with endometriosis are seen to have a lot of immunological markers in their blood. The sixth factor that's being cited as reason for endometriosis is environmental toxins. We are exposed to a lot of environmental toxins these days, and these definitely contribute to chronic inflammation and disruption with the various functions of the body by many other means. Some are of the opinion that environmental toxins do not contribute to endometriosis. However, even if that is the case, these toxins can cause a lot of harm to us. Hence, it would be prudent to reduce exposure to such toxins as much as possible. So, these are the various factors that are thought to cause endometriosis. It's very difficult to pinpoint the exact reason in any particular person. Probably many factors contribute to the development of endometriosis in a smaller or bigger way. One thing to be noted is that in all cases of endometriosis, there is a state of chronic inflammation. There are many pointers which suggest that. I will explain about all that in detail when I come to the diagnosis of endometriosis. So, this is all for now. In the next video of this series, we will be discussing about the various factors which increase the risk of developing endometriosis, the various sites where endometriosis lesions can occur, the different stages of endometriosis, and the various symptoms and signs of endometriosis. Be on the watch out for that. Please do share the knowledge gained here with others. Till I see you again with another video, take care of yourself and your loved ones and stay blessed.